So you got a Baker cyst, and you're not even a baker.
What the heck is a Baker's cyst?
Let's figure it out. I'm Dr. Paul Zalzal.
I'm Dr. Brad Weening. Welcome to Talking with Docs.
Sit down edition.
Sit down, yes.
I like the sitting down.
Sitting is the new smoking, you just told me.
Do you have a light?
We should stop smoking for
All
sure.
right, Baker's cyst.
Okay.
Is it named after a baker?
It actually is not. I didn't know that until yesterday when I looked this up, and it is Sir William Baker, a surgeon from the 1800s, and he was the guy who got it named after him. I'm not sure if he found it or identified it or what, but
He must have paid off the medical naming committee
yeah.
to get the name for the thing that's a bump behind your knee.
Okay, and this is a very, very common problem I see in the office all the time.
Yeah.
Someone comes in, they have an ultrasound report printed in their hand, they want to show it to me. They're like, "Doctor, I have a Baker's cyst." And I'm like, it's a problem, I recognize it, but really for me, it's more a result of the problem than a specific cause of the problem most often.
That's right. That's what I try and emphasize to my patients is
Okay.
the Baker's cyst, don't think of it as an entity on its own. I wish William Baker never named this thing.
I know.
Because it is really a sign or
Okay.
a symptom of something else that's going on, like some arthritis in your knee or a meniscal tear in your knee
Okay.
or something in your knee that causes a little leak in the capsule. And the synovial fluid, which
Yep.
is in your knee and everybody's knee, gets pumped out that little leak into the back of the knee.
Right.
And then it's like a one-way valve and the fluid can't come back in. So the cyst forms, it gets a little bit bigger and bigger and it gets a little bit dehydrated. So it's
Yep.
not quite liquidy, it's more jelly-like.
Yep. And it's most commonly between the medial head of your gastroc muscle or your calf and something called your semimembranosus muscle, part of your hamstrings. So now you know what it is. So it's a sac of fluid that's in a space where it normally is not supposed to be.
Right.
What do these people show up with? How do they present?
They usually present with symptoms from the underlying condition. So some
Right.
knee pain,
Right.
or some mechanical symptoms if it's a meniscal tear.
Right.
However, some people might say they feel the bump at the
Right.
back of their knee as well.
Or they say, I can't bend my knee all the way. I can't get it all the way straight because it feels tight, or I can't bend it all the way because it feels tight.
Yeah.
Okay, so they show up, they got some pain. In your office, you're going to examine them. Can you feel it? Can you see it?
Yeah, I usually do a general knee exam,
Yes.
and then I do palpate back there to
Yeah.
see if I can feel it.
And sometimes it can be big and can be tense and
Yeah.
annoying. You can appreciate that it can be very, very uncomfortable.
Yes, it can. And yeah, sometimes it can interfere with the range of motion, but
Right.
I find usually the range of motion is impeded by the underlying condition.
Right.
Which
your
would
torn
have
meniscus or your advanced arthritis or whatever.
Right. Yeah, your generalized decreased range of motion because of what's going on that caused that.
Okay,
that
so you-
popliteal cyst, which is another name for it there.
That's a more anatomical name, more
Yeah.
useful naming
Yeah.
actually than
Yeah.
naming it after yourself.
Yeah, sorry, Billy Baker.
Okay, so now you know they got this. You see them in the office. Say somehow they didn't have any investigations. Do you order any tests?
I just order my usual tests around the knee, which include a standing X-ray.
Right, and the X-ray, with respect to the cyst, you can't necessarily see it. I guess if it was really gigantic and had some debris in it, maybe you could see it on the lateral view, but probably looks normal, except for the fact is you probably have some arthritis or something else going on.
Right.
Okay, so you go straight to ultrasound.
I almost never order an ultrasound of the knee.
No.
If the story doesn't make sense, or if I'm worried about a neoplasm or a cancer, a sarcoma or
Right.
something around the knee, then an ultrasound can be helpful
Right.
because it would show some kind of blood supply to this mass behind the
And
knee.
even then, would you really order an ultrasound?
Not on most, but if it was a concerning
Right.
story, like it's associated with weight loss, there's a strong history
Right.
of sarcoma,
Pain out of
or
proportion.
it's getting much bigger
Yep.
rapidly. I don't know if when you palpate it, it feels more solid
Yep.
than cystic. Those kind of things do make you worry, and then you do an ultrasound to see if there is a blood supply going to the
Right.
thing, which is concerning.
But then you probably even go to an MRI.
We do, yeah.
Yeah.
Often you get ultrasound.
Yeah, or
last,
both, in both, yeah.
But yeah, MRI would be the investigation of choice. for
Okay,
that.
so you confirm that you have a Baker's cyst, and a lot of times the radiologists are very kind. They give very specific dimensions. It's like 2.6 by 9.5 by 14.3 centimeters in the back. So they range in size. They certainly will fluctuate in size. Patients will say, oh yeah, I feel like it kind of is going up and down in size. So some days I have good days related to activity or other stuff. So you have this Baker's cyst, so now you're going to book them for surgery. You're going to cut out that Baker's cyst.
No,
What?
nice try. No, we don't. Maybe Billy Baker did back in
I think he probably did.
100s or 1800s. They may have been excising them many years ago. I
Yep.
think they excised them, but we do not routinely excise the Baker's cyst
Nope.
for a few reasons. One, it's not the underlying problem with your knee.
Yep.
2, it will likely recur if you have it removed. 3, it's in a very dangerous location. There are a lot of nerves and arteries around that area behind the knee. It's kind of like a no person's land.
Back of the knee.
Yeah,
Back of the knee. You don't want to be there if you don't have to
go
be.
there.
Has very real risk for
Back
sure.
of the knee is not a good place. Even if you're a WWE wrestler, you don't want to see the back of your opponent's knee.
Maybe you're gonna do it like a figure 4 leg lock, like
Right.
Greg the Hammer Valentine, maybe.
That's it.
Yeah.
No other reason.
Okay, so you're not gonna have surgery. So you're like, Doc, just gotta live with this. There's no treatment for it.
What we try and do is treat the underlying cause.
Okay.
So if it's arthritis, we go down our treatment algorithm for arthritis.
Right.
If it's a meniscal tear that's causing it, we go down our treatment algorithm for meniscal tears. We have videos about all that stuff.
Okay, and just on a side note, before I forget, if you've had experience with a bigger cyst, if you've had one rupture, if you've had it treated in some way, please, I know we're going to get to that, please leave a comment, share what worked for you for other people here. So, okay, so maybe an injection before we get to what you're about to say?
Yeah, maybe an injection is part of that treatment algorithm for the arthritis, but you mentioned it.
Yeah, just wait. Routinely, I would not aspirate them, would you?
No.
Because, like we said, it's just gonna, unless someone had a gigantic one that was really tense, and I would not put the needle in the back. I maybe would pull some fluid out of the front if they had a gigantic knee effusion that we thought was maybe the cause.
Yeah.
But the main concern, or the most common time for people to show up in the ER or in your office with severe pain in their calf, what has happened?
That's a rupture. You mentioned rupture.
Right.
You
Rupture.
asked someone to leave a comment if they
Yes.
rupture. Those things they're cystic structures, they can rupture.
Yes.
If they rupture, that fluid leaks down to the back of the calf, and that hurts a lot.
Right.
And
Can masquerade.
Imitates something. What is that entity?
A deep vein thrombosis or a blood clot. And people are nervous about this for good reason because it potentially can be fatal. So they show up, get an ultrasound and say, it's kind of good news, bad news. Good news is you don't have a blood clot. Bad news is you have a ruptured Baker cyst, and there's not much we can do for it.
Supportive.
Yes, so support.
It's going to be okay. That's
Which
about all we
I
can
feel
do
like
for that.
some people are like, that's offensive care is what that is.
Supportive
but really,
care
it's like
means
ice, elevation, compression with a
analgesics.
tensor bandage, maybe some pain medication.
Analgesics.
Analgesics.
Right? So that's the Baker cyst that has ruptured. But the good news is the Baker cyst is gone.
Yes.
Right?
Yeah. So people are like, it was really, really bad and it can be 3, 4, 5, 7 days. It can be really uncomfortable, hard to walk because that's so tight in your calf. But yeah, usually it does make it better.
And are these things kind of like in the family of ganglion cysts?
I guess kind of.
Right? You can see you might have had a ganglion cyst around your wrist, which is a little bit of the outpouching of the fluid there, or ganglion cyst in your foot. You might have had one.
Yeah.
It's kind of like that, except it just goes out the back of the knee.
Yeah. But it can be, they're very, very common, and people really get bothered by them. And unfortunately, almost fixate on them a little bit. They're like, bigger cyst, bigger cyst, bigger cyst.
It's a good news, bad news situation because we don't, the good news is you don't need any specific treatment for your Baker cyst.
Yeah.
The bad news is we don't have any specific treatment for your Baker cyst.
Yeah. And then usually you start to have a conversation. Well, actually, it's because you have arthritis. Maybe that's why you're sore, and that's why you're stiff, and that's why you're swollen. Now you know.
Now you know, but we made a video about this before.
We did, but we're in masks for some reason.
In the hallway.
It's weird.
Yeah, it was a weird video.
It
got a few views.
It was a weird time.
Yeah.
If you like this video, please like it, subscribe to our channel.
And remember, you are in charge of your own health. I feel like you should be holding a banjo.
You should not.
Can you play the banjo?
No, I cannot play the banjo. See you next time.